This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Renal System, Part 2.
Now let's discuss acute renal failure. I have a question. How low would your client's output be per hour that would have you worried? Yes, less than 30 mils per hour. If your client's urine output is less than 30 mils per hour, you must report this immediately. Remember, acute renal failure is reversible if the symptoms are caught early. In acute renal failure, the kidneys can't filter waste products properly. So now we have a buildup of creatinine, urea, and uric acid. What is the normal serum creatinine level? 0.6 to 1.2 milligrams per deciliter. Did you know when creatinine levels rise, we have lost renal function? So I have a question. How much renal function do you think is lost for the creatinine level to rise? Here are your choices: 20, 30, 40, or 50%. The answer is, drumroll please, 50%. Yes, at least 50% of renal function is lost before the serum creatinine level increases. There are three phases to acute renal failure: oliguric, diuretic, and recovery. In the oliguric stage, we will have urine output of 100 to 400 mils in 24 hours. So how much urine output will we have in a anuria phase in 24 hours? Yes, 0 to 100 mils in 24 hours. In the oliguric phase, what do you think is going to happen to our potassium levels? Yes, they will go up because of the decreased urine output. This client is retaining fluids, so what will happen to their blood pressure? The blood pressure goes up, while the sodium is probably going to go down, because we know potassium and sodium have what kind of relationship? That's right, potassium and sodium have an inverse relationship. Now, depending on how long this has been going on, if I osculate, what am I likely to hear? Crackles. If I hear crackles, could my client be having difficulty breathing? Would my patient be in acidosis or alkalosis? Did you say acidosis? Very good. Tell me what other signs and symptoms we will see with this patient in the oliguric phase. We will have potassium and sodium imbalances. And we learn in our fluids and electrolytes lectures, when we have a potassium imbalance, we are going to see cardiac dysrhythmias, and with a sodium imbalance, we're going to have neurochanges, among other signs and symptoms. Remember, in the oliguric phase, we replace fluid lost plus 500 mils to account for insensible fluid loss, such as sweating through the skin. I will say it again. In the oliguric phase, we replace total fluids lost and 500 mils to account for insensible fluid loss. Let's discuss the next phase, the diuretic phase. After the kidneys have gone through the oliguric phase of little urine output, the urine output rises slowly until suddenly we are in a diuretic phase. Class, tell me, what is the normal urine output? Right, 1 to 2 liters. So how many liters do you think the diuretic phase is? Yes, it's at least double the normal. It's 4 to 5 liters per day. But remember, in the diuretic phase, we may see up to 10 liters. 10 liters of urine a day. Yes, and I'm sure with 10 liters, you're thinking shock, fluid and electrolyte imbalances, cardiac dysrhythmias, neurochanges, vascular collapse. Finally, the recovery phase. The last phase is the recovery phase, which can take up to 2 years. Remember, the lower the glomerular filtration rate, the worse off the client. The normal GFR is less than 125. Now, what causes acute renal failure? Well, it could be pre-renal, before the kidneys, intrarenal, in the kidneys, or post-renal, after the kidneys. Prerenal is before the kidneys and could be caused by hemorrhage, hypovolemia, cardiac output, and or renal perfusion. Intrarenal failure is within the kidneys. It could be caused by nephrotoxins like aminoglycosides, those drugs that end in myosin. It could be due to prerenal failure or infections like glomerulonephritis or even renal injury. Postrenal failure, these are problems that occur after the kidneys, like calculi, also known as stones. It could be caused by benign prostatic hyperplasia and tumors or strictures. What are your nursing interventions for a patient in renal failure? One thing we do know is anytime you have a fluid volume problem, we are going to weigh them daily. Same time, same scale, same clothes. We will see decreased urine output, weight gain, and edema. As far as test results, well, in the oliguric phase, the urine output will be 100 to 400 mils in 24 hours. This phase usually lasts up to 2 weeks. Remember, nothing is 100%, so in some clients, we may not see oliguria. The blood urea nitrogen, or BUN, and creatinine. Why? Because the kidneys are not working. The signs of uremia include pruritus, client has a lot of itching, anorexia, or nausea and vomiting. And specific gravity will be fixed at 1.010. Let's just try that all again. With kidney failure, we will see an increase in potassium. Why? Because of the volume of urine. Urine output will be decreased because the kidneys aren't working. Sodium will be decreased because it's dilute. The pH will be down because the client is in acidosis. Why? Remember, pH and potassium have an inverse relationship. We'll also see metabolic acidosis, and the specific gravity will be fixed at 1.010. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.